Yali Madat. Today, we are fortunate to have Dr. Adil Nathoo, a GP in Hertfordshire, who also works at a COVID hub, join me on our spotlight on the vaccine. Adil, you're on the front line in more ways than one. Obviously, as a doctor, you have been very busy, but you've also been supporting some of the vaccine trials. Can you tell us a little more about your work with the vaccine trials?
Absolutely. It's been a really interesting experience for me for the last few months being involved in the COVID vaccine trials in Oxford. And interesting to see how much focus there has been on safety all the way through. These vaccine trials are done as multi-centered, so different parts of the world are all trialing the vaccines, and they're done in participants of different ages and with different medical problems, and so it's been interesting to see how much focus there has been on safety.
Okay, great. So your work with the vaccine trials has given you that confidence in the way that these are being handled.
Absolutely.
Okay, good. So there is a lot of interest in people wanting to take the vaccine, which is great news. But at the same time, people also want reassurance. So what reassurance can you give to us?
I think that's been one of the main questions that I get is, how do we know this is safe? How do we know that these trials are not being rushed? And I think what I would say is that across the world, 40 million plus doses of these different vaccines have been given. They are not skipping any steps. They are making sure that these vaccines are safe before the regulatory bodies like MHRA have licensed them. And if there were any safety concerns, the trial would have been stopped, and then it would have been investigated. The reason that these trials have kind of gone faster than they would have normally is that governments have essentially pumped money into them, and have purchased these vaccines before waiting for the trial results. And that has let companies start manufacturing them before the final results of the trials have been out, which is not how we normally do it, but has been done so that we can get these vaccines out as soon as possible.
Okay, excellent. And I know the regulatory authorities have also been monitoring the trials from an early stage, and that has helped in a big way as well. Good. So what are the common side effects from taking the vaccine?
That's another quite common question. Most people have very mild, if any, side effects. Some people will get a little bit of tenderness in the arm that they have the vaccine. They might get a little bit of pain, maybe a bit of redness, and then maybe a bit of bruising where the injection's given. They may feel a little bit unwell in themselves, a little bit tired perhaps. Some people get chills or feel feverish, or a mild headache. But most people have very mild symptoms, and they tend to go away within a couple of days.
Okay, great. And you might have some symptoms after the first dose and nothing after the second dose, or vice versa.
Absolutely.
Are there any medical conditions where the vaccine should not be taken, Adil?
There are very few people that should not have a COVID vaccine. So if you've currently got a fever, or if you've had COVID within the last 28 days, we would say that we hold off until 28 days have passed. But apart from that, there really isn't anything else that would stop you from having a vaccine. In people that have had anaphylaxis, so a serious allergic reaction to a vaccine or to multiple classes of drugs, or unexplained anaphylaxis, you need to let the staff at the vaccination hub know, and they may decide to give you one vaccine over another, but it should not stop you from having a vaccine. They are offering vaccines to women who are high risk, who are pregnant, and they would also suggest that people who have an immunodeficiency or problem with their immune system to have the vaccine. Although if you did have any questions, it is worth asking your doctor. And patients who are on a blood thinner are also fine to have a vaccine. It's, again, just letting the doctors at the hub know.
Okay, great. And as a GP, can you share some of your personal experiences of what it's been like to be working in this second wave of the pandemic?
It's been really difficult. The last few months, we've seen more and more COVID cases, and it has been interesting volunteering with the Health Advisory Service. So we see how much this is affecting the Jamaat as well. And as hospitals are becoming full, we're having to make difficult decisions. But I think the thing to focus on is that light at the end of the tunnel, and that things will hopefully start getting better over the next few months as we start rolling out the vaccination program to the population.
Okay, great. And indeed, this really is our big hope to get us out of this pandemic. So what is your take-home message, one take-home message for the Jamaat?
I think the main take-home message would be, don't believe everything people send you on WhatsApp or by email. I think there's a lot of really good information out there, but there's a lot of poor information as well, or misleading information. I had my vaccine last week. I had very few side effects, a little bit of a sore arm for a day afterwards. But I wouldn't have had it if I had any concerns. I've recommended the vaccine to my parents and to other family members, and I wouldn't have done that if I had any concerns. So I would strongly suggest that if and when you are offered a vaccine, that you go out and have it.
Okay, great. Dr. Adil Nathoo, thank you very much.
Thank you.